It's time for Solutions for Seniors to Be here on WATD. Here to help make your golden years golden, offering guidance on programs and services available to you and your loved ones in your retirement. Now, here's your host, Chris Shea.
That's right. Good Sunday morning, everybody. It's Chris Shea here, BPS Financial Services. Hopefully this is the right place and the right time for you, because I think we're going to have a wonderful Sunday morning here. One of the services that is out there and available that a lot of people, I think, have questions around are these things called VNAs and what they actually provide in terms of their services. So we have the pleasure today. I've got three guests, all from the Brockton VNA. We've got Ernesto, Dana, and Ava. And I'm going to let them introduce themselves and introduce the Brockton VNA to you. So we're going to start with the head honcho himself, Mr. CEO Ernesto.
Good morning to all the audience. My name is Ernesto Moreno. I'm the president and CEO of the Brockton Visiting Nurse Association. I'm delighted to be here today with my colleagues, Dana DeMiles and Ava Hallam, and I'm going to let them introduce themselves.
Good morning, everybody. This is Dana DeMiles, Director of Business Development for Brockton VNA. Very happy to be here to talk to you all about what home health and hospice can do for you in the community and how you can get our services. Thanks.
This is Ava Hallam. I'm the Care Transition Specialist with the Brockton VNA, Home Health and Hospice, and my focus is basically in the hospice division.
Yep, and they're all, it's all pretty important. And I know that I've gone through the latter stages in life. Both my parents passed away. My father was actually in a hospital. He was on machines, and we just pulled the plug. My mom went to the hospital, came home back to rehab center, and then went into hospice care. And one of the things that I've learned since then is that there's this other thing called palliative care, and there's hospice, and there's all this other stuff that's involved in it. And part of essentially the reason why I'm doing this is because I don't want people to go through the same headaches that I went through. So in your guys' view, what's the difference between hospice, palliative care, and they're pointing at each other like, here, you get the ball.
I'd love to field this one. I've been in the home health and hospice world for a long time. Palliative care is symptom management. You're going to have folks out there that are rehabbing, that have pain management issues, symptom management issues, behavioral issues. Those can be palliated. There are folks that need palliative care that are trending towards the end of life, but as someone finds out that their terminal illness is advancing and they have to transition to hospice care, they will be transitioning to end-of-life care. And that's where we deploy an interdisciplinary team of people to support not only the patient, but their loved ones. One of the things that I think goes that isn't recognized is we end up following patients' families for up to 13 months after a patient passes. And I think that is one of the more impactful aspects of our services, because the mourning period starts when you hear that word hospice, and it never gets easier. And we're there to support that transition. We're there to support the comfort of the patient and, the comfort and security and of the family that has to witness what's happening to their loved one.
And I'll talk a little bit about the hospice, the team approach. I used to be a hospice social worker in the South many years ago.
You're from the South? I didn't pick that up.
You didn't know that? Yeah, now I live in South Dartmouth. So with hospice, it's a difficult conversation to have with families.
It can be.
It can be, and that's why I try to do an educational approach with hospice to explain. It's a team approach, not just for the patient that needs the hospice, but for the family. To come on to hospice to qualify, you have to have a terminal diagnosis, and in the best estimate of the doctor, no one has a crystal ball, if it progressed as it does today, you would have 6 months or less to live. But the studies also prove if you come on board with hospice, you live longer than those without. And I think it's because the extra attention, the team approach. We have a medical director who oversees your care. You can continue with your PCP, but we have a medical director. We have a nurse who's basically a case manager. We have certified aides that are in the home that assist. We have chaplains, and the chaplains, as I explained to family, it's not, quote, just for religious purposes. It's for support. It's for guidance. They can sit, they can play music, they can talk with the patient and or the family. And the social worker, whose goal, again, is to get resources to the family to make everything a little easier. And we have volunteers who can come in, who are trained, who can sit with the family and provide some relief. The other thing about hospice, there's no cost. It's covered 100% by your Medicare, your insurance. We provide all durable medical equipment for a hospice patient. What that means is we provide the hospital bed. We can provide the bedside commode. We can provide the diapers, anything like that. We provide all medications related to the hospice diagnosis. We take care of all that. So it's a lot of eyes and sets of eyes on the patient and just a lot of support and help for the family because our goal is comfort and quality of life.
Yeah, and I think that's something that gets lost. I know when my mother was getting toward the end of her life, it was during the pandemic, so it was really, really hard because I couldn't even go visit her when she was in the rehab stage because she went to the ER, she got better, went to the rehab portion of it. She was there for 2 weeks. She was non-participant, and the doctor essentially said to me, he said, look, she's got a 1% chance of making it, and it's about her participating. So we're going to go to hospice. I said, great. He's like, you get 2 weeks left. Those are the best 2 weeks. Because for the 2 weeks while she was supposed to be participating in the rehab, I fought with her every day about participating, getting healthier. Once we went to hospice, I was like, okay, great. Like, let's just enjoy you.
Yep.
Yes.
And I tell the story quite frequently, but my mom was a place here in Norwell, and I was talking to her on the phone, and I said, yeah, I'm going to get Taco Bell with my daughter, and she goes, oh, I'd love some Taco Bell. Now, mind you, she hasn't eaten in a month. No solid foods. She had the IV to enrich her with nutrients, but the next day I showed up with 2 bags of Taco Bell that I spent like $20 on. And the nurses all looked at me like I had 7 heads. They're like, what are you doing? And I'm like, she asked for Taco Bell. I spent $20. This is what she asked for. If she doesn't eat it, y'all can enjoy. And I said that because I lived in New Orleans for 5 years. So the y'all falls in there for me a little bit. But I said, she asked for it. This is what she wants.
Right.
We're going to give it to her.
Right.
And end of story. And they kind of looked at me and went, oh, okay. I said, no, we're going to leave. Enjoy the food.
Right.
And that's going to be opened.
And it's really good that you're pointing that out now because I know that the word hospice can be sometimes concerning or scary for patients and for family members. But the hospice, what it does is basically facilitate and provide a lot of services towards that period that is imminent. And most families and patients get benefited from it because they get services that they couldn't enjoy in any other setting in our healthcare industry. And in hospice, we are able to provide those services. And that last wish that the most patients have, they're always willing to and able to provide. I remember I've been all over the country for more than 20 years in the industry. And we had a patient in Corpus Christi, Texas, and that patient had never seen the beach, living in a beach town. And one of his wishes
Really, Corpus Christi is right in the water.
He's right in the water, yes. He was there. He wasn't from the town, but, he was inspiring down there. And they said, well, my last wish is just to see the beach. And so we coordinated with all the team members. We hired a patient transportation, and we provided that wish. And here at the Brockton Visitor Nurse Association, we are willing and able to provide all those services and all those wishes for our patients.
Some of those, it's one of the most challenging fields to work in, And some of my best memories are the memories of fulfilling those final wishes. And one of a medical director that I worked with in the past, actually with Ava at a different agency, he called it aromatherapy. He said a lot of his patients would request certain foods they know they couldn't eat. They were on a pureed diet, and he wanted a 48-ounce steak. But it was the idea that they got to smell
I can smell the steak Sunday morning and steak and eggs.
Yeah,
Yeah.
and it's
Smell
one
the
of those.
steak.
And as a healthcare provider, some people are just cure. And when people get that sense, that memory fulfilled, it's calming, it's relaxing, it helps keep patients' anxiety down. You're in an end of life scenario. Doing something that's going to put a smile on the face is just so impactful, and those are some of my best memories as a healthcare professional.
Yeah, I mean, I talk about my family, and my mom's happy place at the end of her life before she went in the hospital was her boat.
Yep.
She would go to her boat 6 days a week in the summertime. She'd work on her iPad. She was a realtor, so she'd just be on her iPad and be on her phone and be on the boat and sipping wine and driving back from where she lived in Hanover to the boat in Marshfield, and she absolutely loved it. And that was, I can remember, like, when I was in the trying to get her healthier, I was like, get healthy, we'll get you on the boat. Get healthy, we'll get you on the boat. That was the carrot for her to try and enjoy life. And the one small regret that I have about the whole thing is that she passed in March. If she had been able to make it till April or May, we would have gotten her on the boat, right? And in this process of my delving into these topics, I've already told my daughter, I'm like, you know what? At the end of my life, I want to be on the boat. Because I inherited the boat. But I'm like, I want to, as much time as possible just on the boat. And if the boat gets out on the water, great. But if it just sits in the dock, that's still fine, because there's nothing like floating on the boat for me. For some people, that doesn't work because they don't like the water or whatever. But you got to be able to communicate with your loved ones and the people caring for you what you exactly want, which I think is a big part about what you guys do.
Absolutely. One of the bigger challenges is that we face on a daily basis is unrealistic goals of family members, and sometimes the patient has it clearly written out what they want, and then you have family members that are having a tough time with the situation, and they're imposing their opinion instead of following their loved one's wishes. And I would
say that happens 75% of the time.
It happens often. It happens very often. And we, as healthcare professionals, we try to educate people on how to find success in this process for them to continue to follow their loved one's wishes. And it's a challenge, but it's something that we navigate on a daily basis. And sometimes our initial meeting with the family can start that process. Because, again, hospice is a scary word. When you hear it, you think everything's immediate, you think everything stops, and that's just not the case. Where most often the plan of care doesn't change. A lot of times we're coming on board in addition to whatever services they already have, and we're there to support the family and the patient through that process. So it is a hurdle. It's a hurdle that we're used to, and it's a hurdle we're used to navigating. So if families are out there and they are considering something like that, or if they're dealing with something like that, give us a call, because we'd love to help you better understand what's happening. And as Ava had mentioned earlier, there's no crystal ball. We've admitted patients onto our service that we thought were going to be with us for the full 6 months, and unfortunately they were gone the next day. And we've admitted people onto our service that we thought were going to be gone the next day, and they actually graduated from our service. They got better, and it's you just never know. The one thing that we do know is we can't help the resident or the family if we don't admit them to our service. So if we get them on our service, then we can provide them that support, and we can help them navigate the challenging part of this.
All right, so there's a lot there that I want to talk about again, but we're going to take a little bit break here, hear from sponsors, and then we'll be right back. Are you fit to retire? I'm Chris Shea, financial advisor with BPS Financial Services in Marshfield. I work with clients to create a 100-day plan that can help get you started so that you can get the most out of your retirement. You've worked your whole life towards your goal of retirement. Let BPS Financial Services put together a plan that will help you enjoy your retirement. Find out how a 100-day plan tailored to you can help you get started in your retirement at fit2retire.com/Chris-Shea or call 781-733-5996. That's 781-733-5996. And now for my fast read disclosure, as this has been compliance approved.
Chris Shea is a registered representative offering securities and advisory services offered through Cetera Advisor Networks, LLC, member FINRA/SIPC, a broker-dealer and registered investment advisor. Cetera is under separate ownership from any other named entity. Located at 752 Ocean Street, Marshfield, Massachusetts, 02050.
That's 781-733-5996. All right, welcome back with the Brockton VNA. One of the things that you mentioned there before the little break that I think was not clearly communicated as well as I think it should be. When do you think families should have these conversations around what the care should be, in terms of when they start to get in the process with you? Like, so if mom and dad is being brought in, when should the conversation start with the kids, or when should it have started with the kids? Is probably the better way to lead you into that.
I think a lot of what we deal with ends up being emergent. Something happens, they end up in the hospital, and here we are. And that's why it's really challenging. If somebody has a terminal illness, if they have a end-stage liver disease, if they have a kidney issue, if they have a cancer, they should broach the topic almost immediately. Unfortunately, I had dealt with this when I was in high school. My mother was diagnosed with cancer.
This is why you're in the industry.
Yeah, and my mother's in the industry as well, and my mother's a very realistic person. And while it was my senior year in high school, my older brother was a sophomore or junior in college. And my mother had to have the very real conversation with us that I have cancer and this could go in a way that we have to have plans in place. Just because if you ever get to that point where you have to make those harsh decisions, you don't want to feel that pressure. You want to know what your loved ones' wishes are. Yep. My mother-in-law says it all the time. Unfortunately, she's lost a few people in her family. She says it. She's like, Dana, you need to be my healthcare proxy. You're the only one that will do what needs to be done. And
you'll actually do what I want.
Yes, and because you have to. It's what they want. It's not
a responsibility and an honor.
Yes. So I think if as soon as that pops up, whether it's that emergent case, you end up in a hospital and everybody has to get there, or if it's you are diagnosed with something that could be very bad. And I hate to use such a dumbed down word, but it's sometimes it could be anything. It could be the littlest thing, and if you don't catch it early enough, all of a sudden it's something very, very serious, and you want your family prepared for that.
Yeah,
that's just my opinion.
No, and again, I'm a financial advisor.
Yeah.
So I deal with people and their money, and I tell people all the time, like, somebody asked me when the best day to start planning for retirement was. I say today, or 20 years ago, because the plan is the important thing. If there's a plan, you can actually do it. I do presentations for the Alzheimer's Association on managing money around this, and one of the scariest stats is that 44% of the caregivers have anxiety and depression, and it's simply because they haven't been communicated with about what the person with Alzheimer's wants and what their wishes are. So they're making blind choices for a loved one that are based upon their values, not what their parents or loved one wants. Which is why that early communication, even if you think it's somewhat morbid, gotta have it.
One of another unique. I was a nursing home administrator once upon a time, and when you're admitting patients from the hospital and they're on their state and federal benefit, a lot of times the family members sign over the financial responsibility to the nursing home. And that means the nursing home is doing the spend down because they don't know what to do.
Yeah.
So
that's scary.
It is, and it was one of the hardest things I'd ever done, because there is a patient paid amount there, and the nursing home sends the bills, and they don't want to pay it. They want it, so they're like, all right, you just be the financial responsible party, and then if they don't pay their bills, then you have to. It was the least favorite part of the job for me. Which is why I like being on the sales side now. Sorry, Ernesto.
That's why everyone has a different role.
Of course. I think it's really important to just be prepared. And obviously, those emergent things do pop up, and you're not always ready for it. But if you have those conversations at an earlier age, you can be more prepared.
And also, if you have those conversations, it prevents your family that's left, whether it's your siblings or it's your children, from fighting with each other over, well, mom wanted this or sis wanted this. Why are you saying this? It's all settled. So it lessens the stress in the family.
Yeah, I tell people all the time, if you want your loved ones to love each other after you're gone, tell them exactly what you want. Mm-hmm. Otherwise, they're going to each bring in their different values and their perspectives. Right. And, kind of happened to me in my with my circumstances around my family. I knew what my mom wanted. My brother didn't listen to her and didn't want to have the conversations. And, it's challenging.
Absolutely.
Very difficult, yeah.
Yep.
So the Brockton VNA, it's a new organization, from what I understand, it's got a mission as a nonprofit. Mm-hmm. So tell me a little bit about that.
Well, I think it's really important to point out we are a nonprofit organization, so all the proceeds are getting invested back into the community. We are not the kind of organization that is trying just to fill the pockets of the stakeholders and trying to make as much money as possible. For us, patients means really something. They are not just a number. They're just not a goal that we're trying to achieve. The patient is unique, is individual, and we're always trying to tailor those services to the patient needs. It's not about, that's what we do. No, we do whatever the patient needs, and we're always going to be willing to tailor-made our plans of care based on the patient needs and whatever the patient and the family members require. You pointed out that we were a new organization, and we're probably the oldest visitor nurse association in the entire country and probably the entire world. We were founded in 1904. Mm-hmm. I don't know if there is any other out there in the community that is older than this one, but this is basically, it's significant. Since 1904, it's been assisting and helping the communities where we serve.
It's 109 years, if my math is correct.
119.
119 years. We're going to be 120 years next year. We're getting ready to celebrate it. Yes.
I was going to say, as of January 1st, or when's the actual date?
April.
It's April. Yeah. It's somewhere in the spring, and we are trying to make a big celebration.
Yeah. It's one of the most one of the more impactful parts of our office, and we're near the fairgrounds in Brockton. It's an older building, but when you sit in our waiting area, we have the original sign from 1904 it's up on the wall. It's tiny. It's when you think about the way that we advertise things today, you think about Times Square. You have this tiny little metal sign that was probably out in the front lawn that is now a parking lot, and it's amazing that Brockton VNA is still here. They've partnered with all the local hospitals, all the local nursing homes, as a top VNA and hospice provider in that area. They've been committed to the same 30 towns throughout our existence. We've never tried to grow beyond what we are, and we've always just said yes. And it's one of the things that we're really proud of. If somebody needs services in Brockton, we're there to take care of them. Regardless
the insurance they have, because I know that nowadays a lot of healthcare institutions, they really focus on just getting the insurances that pay more. Right. And we take care of our patients regardless. Sometimes patients don't have any kind of insurance. Well, we'll take it. We'll do whatever is right for the patient.
And with the hands-on staff, a lot of longevity with our staff. They've been there for 30,
we have team members who've been 40 years with us.
40-some years with us. So that's the same. You're going to have the same nurse. I mean, exception,
Right,
somebody's sick,
yeah.
holiday, something like that, vacation. You're going to get the same nurse. You're going to get the same aide. Social. There's a lot of longevity and consistency, which helps families also.
Yeah, and so one of the things that I know is that what y'all do isn't, there is a shortage in the nursing world right now because of the pandemic and because of the aging population. But most people are not getting into what you guys do because they want to become millionaires.
Exactly.
I mean, it's not something that is glamorous. Nobody's going to be on, TV for any of the good reasons for what you guys do. It's if something goes horribly awry, which happens very infrequently, which is why it never happens. And you guys don't get talked about. But you guys do the stuff that helps people at the end of their life have a little bit of dignity, right? Because that's kind of what everybody wants. Back in November, I had a guest on, and she talked about having the conversation about death with your loved ones and getting prepared with your end of life choices. And like I said, that's when I started to think about myself and said, I just want to be in the boat. I just want to be in the water. Like, get me as close to the water as you possibly can. Granted, I'm not like the person in Corpus Christi who had never seen the water before. I grew up here. I just love the water, and that's where I get my calm and my peace.
And besides providing the hospice, and Dana can address this and Ernesto a little bit, it's more their areas. We do Visiting Nurse Association. We have home health. Helping people with, we provide therapies, physical therapy, occupational therapy, speech therapy in the home to help people and let them address that.
Yeah, we are a true post-acute care continuum of care. As soon as you leave a nursing home or a hospital setting, or if your PCP thinks that you need additional services to get back to your baseline, if the referral is made to us, our VNA can be out there same day, next day. And we can start services right away. We generally have nursing and PT involved in most cases, and then our continuum of care functions that in a way that if a referral is made to palliative care, it's actually a member of our hospice team that will go out, do an assessment to see how we need to palliate, or whatever it is there is that we need to palliate. And if that person does progress into needing hospice, then the caregiver transitions with them. So it's a continuum of care with continuity of care, and I think that's very rare nowadays.
Continuity is definitely an important part of that.
Absolutely.
When we sat down, you guys are like, oh, we got a half an hour to fill. We're almost done with half an hour.
Yeah.
So if someone were to, want to get in touch with you about learning more about your services, how would they go about connecting with you? And I'll let you grab your card so you can actually read it and make sure that it's all accurate there. And
Yep.
So how would somebody get in touch with you guys?
A couple different ways. One of the things that I really love about our team is we have an intake team that supports every inbound referral. So if you're in the community and you're curious, you can give us a call at 508-894-5208, or you could go online to brocktonvna.org. There is a referral form there as well. And if you are going to visit your PCP or you have a visit in the near future, you can just ask your physician's office to give us a call, and we'll come out and we'll work with them to get you guys on service.
Cool. So again, we're coming to the end of it. One message you'd like to give to people as they deal with loved ones that are in the latter stages of life that you think is a good piece of recommendation?
First of all, we are here to help. And we are not going to be looking at the expenses that we are going to incur. We're just going to do what is right for the patient. And that is a really important message.
I would definitely say, listen, I mean, I think a lot goes, I think nowadays, sometimes people can disregard their elders. And I think that some of the greatest stories I've ever heard are from people that I barely know because I just sat and listened. And that's just invaluable information from great life experience, and really just appreciate what they've been through. Everyone always feels that right now is the hardest, most difficult thing they've ever been through. Well, our elders have gone over it over and over and over again. So just be open-minded, hear them, and appreciate that.
Yeah, and we're just there to provide support and help.
Yeah, and sometimes all people want to do is share. Much to your point, Dana. Well, this has been a fast half hour. Told you guys it wasn't going to be that hard. It is a Sunday morning, so coming up next, we got the car guy. Have a happy weekend. We'll catch you later.
Have a great day.
Thank you.
I've been in the right place, but it must have been the wrong time. I done said the right thing, but it must have used the wrong line. I've been on the right trail, but I must have used the wrong car. Headed in a bad place, and I wonder what it's good for. I've been in the right place, but it must have been the wrong time. My head is in a bad place, but I'm having such a good time. I've been running, trying to get hung up in my mind. Just got to give myself a good talking to this time. Just need a little brain salad surgery. I got to cue my insecurity.